You know, you've always heard it said, there's a right way and a wrong way to do everything. That's probably what Congress and certainly what our constituents have learned about healthcare. A right way and a wrong way. What we do know is that the Affordable Care Act was not working. It has run up the cost of health insurance for individuals in the marketplace, individual marketplace. This year, the increase is over 60%. It's also running up the cost for small business employers and for companies. We're seeing those insurance rates skyrocket, even with TennCare. When we went through some increases, they were not as high as these. So what we have heard from individuals all across the political spectrum is the cost of insurance needs to come down. It does need to be more affordable, and once you get an insurance card, let's have access to care. One of the problems with the Affordable Care Act marketplace is the networks are so narrow. People have an insurance card, but they can't get in to see the doctor. These are all problems that we are seeking to remedy. And of course, it's taken us a while to get a bill that is going to have the support of a majority in the House. But what we have is a bill that is going to achieve some really important things. I think it's important to note that, yes, pre-existing conditions, that's an idea that started with a Republican member back in 2006. Of course, we're keeping those protections and increasing those protections for those with pre-existing conditions. Children that are up to age 26, of course, that's another of the Republican ideas. It's been around for a while. We want to make certain that parents know that those young people who are in college completing those degrees, looking for a job, that they're going to have health coverage. It's important to do because our goal is to make certain that everybody has access to affordable insurance and access to the health care. There are also some other important components that are in this bill. Block granting Medicaid, sending the oversight, the authority, and the money back to the states so that the states are delivering health care through the Medicaid program. You all have wanted us to do that, and now finally it is happening. Indeed, the bill on the floor for us today is the bill that is going to provide the most substantial and noteworthy reforms that have ever been made to the Medicaid program. It has the support of governors, of state electeds, of physicians, of those in the delivery system process to be certain that individuals have health care. There's also $1 trillion worth of tax cuts that are embodied in this bill. That is important for all Americans. We also have several other things. You're going to find these on my website, blackburn.house.gov, and you're going to see a set of slides there that go into detail explaining the amendments, how we go about increasing opportunity for our states to work with those with pre-existing conditions or chronic illnesses. Be sure that you log in and read those. You'll want to also look at the McSally bill. As you know, members of Congress and our staffs are in the Affordable Care Act marketplace. This bill by Ms. McSally makes certain that members of Congress will not be exempted. Currently, you've got individuals that work on the leadership staffs. They're exempted. So we have a bill that takes care of these exemptions, and we feel like everybody needs to be covered by this legislation. Take a look, read it all. I could go on and on. The video would be too long to watch. It is a good legislation. It is a good step. It is in the right direction. It is solid. And, you know, the goal, let's make certain that everyone has access to affordable health insurance. Once they get insurance, they have access to affordable health care.